Hello, this is Dr. David Green, CEO of the Ohio Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans will experience back pain at some point. Regardless of whether or not treatment is sought, 90% of back pain gets better within 6 to 12 weeks, so the odds are in your side. Unfortunately, a few will end up with chronic back pain. The definitions are as follows. Acute is 6 weeks or less, subacute is 6 to 12 weeks, and chronic back pain is over 3 months. It's the second most common reason for doctor visits. Half of all working Americans admit to having back pain each year. It's the most common cause of disability worldwide, and the direct and indirect cost of back pain annually is about $100 billion. What are the causes of back pain? Well, we're going to go through soft tissue causes and what's called hard tissue, meaning bony causes. First and foremost, the most common cause by far, more than all the others combined, is a back sprain or strain. You were lifting furniture over the weekend, you were doing a weekend warrior activity with football, whatever the case, that's by far the most common. Here's what a normal disc looks like, a cartoon of it. You have two areas. The annulus is the outer layer, which does have nerve endings in it, and it can feel pain. And the inner jelly layer, which is called the nucleus pulposus, there are no nerve endings in here. You can't feel pain inside the disc, okay? As the disc starts to degenerate, basically it loses water. From the side, what you can see is here's a healthy disc, and then here's what happens. It starts to compress as it loses water and bulge out appropriately. Here you basically have no disc left at all. So when you have a bulging disc, you basically have what we just saw where you have disc that is bulging out. This one actually has herniated and it's pinching on a nerve root, okay? So normally it would be kind of like this, and here it's actually, and some of the inner part is squeezed out, okay? On the right here, what you have is a torn disc. So you have the inner nucleus pulposus, the outer part is the annulus, and here you have a tear, all right? This can be very painful, and it can be hard to see on an MRI. Okay, so just because somebody has back pain and the MRI doesn't show anything dramatic, it may mean that something like this is happening. This can spark up inflammation and actually can help, not help, but hurt the nearby nerve root by causing inflammation and sciatica. And you might say, well, I don't see a herniated disc on the MRI. That might be what's happening though, okay? Sciatica involves one of the components of the sciatic nerve getting pinched. Now, the sciatic nerve is an actual nerve, but it doesn't come off the spine like that. It's actually 3 nerve roots, 1, 2, 3, that come together to form it. L4, L5, and S1. Those come off the spine, they come together, and they go down the back of the leg. So depending on which nerve root is getting pinched, that's where sciatica will affect the lower extremity. Okay? Here you see a bulging disc pinching on the nerve root. Depending on which nerve root that is, L4, L5, or S1, that's going to dictate where the symptoms are in the leg. All right, so when it comes to bony causes of back pain, number one, by and large, is arthritis. There are numerous joints in the back of the spine called the facet joints. They're about the size of a thumbnail. They do have cartilage, just like the hip or the knee, and they're prone to arthritis. Now, for the sacroiliac joints, there are 2, one on the right and one on the left in the back of the spine, okay? They can cause anywhere up to 25% of back pain, and they're often overlooked, okay? So it may be that an injection into the joint can be very beneficial for the relief of that pain. Scoliosis in adults is a significant source of back pain. It can either be an exacerbation of scoliosis from an adolescent as you go into adulthood, or it can come on by itself. A lot of times arthritis doesn't occur in the spine symmetrically, so you can end up getting worse arthritis on one side than the other, and you end up with a curvature. Okay? Spondylolisthesis is a fancy word, but really what it means is spine, and then listhesis is slip. Okay? So when you start to get arthritis, what can happen is one level can start to slip on the level below it, and that's called spondylolisthesis. So you can have back pain as a result of that. Also, you see this area right here? There's a nerve root coming out from there, and up here as well. So when you have slippage of one vertebrae over another, you're actually pulling traction on that nerve root, and that can cause pain. Okay, so you can have back and leg pain when you have a spondylolisthesis. Spondylolysis is mostly in youngsters who are either involved in sports like gymnastics or football, repetitive ones that lead to extension in the back and stress on this area right here, which is called the pars interarticularis. It's just a name for a bony area, and when it's fractured, that is called spondylolysis and can lead to back pain. Probably won't need surgery. Most of these just burn out with the pain. Patient can have a brace. They can have some rest and relaxation for 4 to 6 weeks, and then this can relax and the patient can slowly start getting back into those activities. Spinal stenosis is usually not a cause of back pain so much as it is hip, thigh, buttock pain. Here's what's happening. You have the spinal cord here. You have a nerve root that's trying to get out. Through arthritis, you have this bony overgrowth coming out from the disc, and here coming up from the facet joint. See how it comes in, and it can pinch. That's called spinal stenosis, okay? So the arthritis can cause the back pain, but pinching the nerve root, that's going to lead more to pain in the buttock and the thigh and the hip. Uncommon causes of back pain, you have to watch out for infection. This can be an infection either in the disc itself or in the vertebral body, okay? A fracture, such as you see here, is usually due to osteoporosis. It can also be due to a malignant tumor that has metastasized into this area. It could be prostate, could be lung, or it could be something primary like a multiple myeloma. But usually it's just from osteoporosis, okay? And we have a new treatment for that called kyphoplasty, which works really, really well. And then the other uncommon cause of back pain is a tumor. And this could be either in the soft tissues around the back, or it could be something like I just mentioned in the vertebral body itself. The top non-operative pain management for back pain is through the Ohio Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at ohiopainnetwork.com and then call us for more information and scheduling at 888-466-9898. I'm Dr. David Green with the Ohio Pain Network. Your pain stops here.